Welcome to the new episode of the Myles High Podcast. This is Myles Munroe Jr. Ladies and gentlemen, welcome. As you know, always on the podcast, my vision and purpose for this podcast is to entertain, educate, and elevate you miles high above your fears, your doubts, and any limitations that you may feel exist. Keeping in mind that those limitations only exist in your head. Okay? Feeling good today. Crew is here. Everyone looks good. Everyone feels good. Got a special pod for you today. But before we get to that, I just wanted to, I was thinking about this week just how much I like to help people, right? I really get gratitude about lending a hand and being able to help in any way that I can. And I was thinking about it this week and realized that it's just something that's embedded in my DNA, right? It started with my grandparents on both my dad and my mom's side. Both of my grandparents, all of my grandparents were persons who loved to help people. And obviously it trickled down into my parents, both of my parents, and I think it's embedded in me now. And I just enjoy helping people, man. And that's, whether it's lending funds or giving monetary donations or giving my time or lending some advice. Helping people is something that I enjoy, right? And I think it's a principle of life, right? Do unto others as you will have them do unto you. And it doesn't have to be something where you're helping the less fortunate all the time. It could just be helping a friend, or helping a family member, or doing something on your job where you're going above and beyond what you would normally do, right? And I think that's what it's about. And I don't do it for recognition. I don't do it for anything in return. And I think that's the best part about it, because you have a lot of people out there who help and donate and do things for others for recognition, right? We live in a social media world where people are often seeing helping others on the streets, the less fortunate, and it's always recorded. And I'm always skeptical. I mean, for a lot of them, I feel like it's genuine and it's something that people mean wholeheartedly. But there are some individuals that do it just for the recognition, just for the clicks, just for the likes. And that's not the way to do it. But my point in saying all of this is I want to encourage each of us to, on a daily basis, help someone who you're able to, and whatever that help is, whatever that assistance that you can lend to them, do it. And I think you're gonna see it given back to you or paid back to you far above and beyond the help that you give. And I always say that my wife and I feel like she has the heart that I have, right? We love to help people, and it's ironic that we share so much similarities in the things that we like to do, and helping people is one of those. And she would come to me and give me a story and be like, "Yo, I read this, or I heard about this person, and I think we should do this or do that, or whatever the situation is." And I think it continues to allow us to be blessed, right? Because I truly believe in the saying that you're blessed to be a blessing. I feel that wholeheartedly. And I think some of the blessings that we continue to see comes from the assistance that we continue to give. And that's a principle that I think you can take on. So, I want to encourage, like I say, each and every one of us on a daily basis. Let's try to just help, man. Just give and lend a hand to those who are in need, whatever need that is. I just wanted to get that off. I really was thinking about that coming into this particular episode. And speaking of this episode, and speaking of lending a hand and helping people, I think it just fits right into this episode, right? Because what I wanted to discuss on this episode, the topic of this particular episode, we're going to be discussing mental health, right? And I think it's a topic that has become widely discussed, especially in the last 3 to 4 years, and I'm happy for it, right? Because this is a subject that has been in existence for quite a while, right? From back in the day, from 2,000 years ago, mental health and mental illness has existed. And it's always good when we could have discussions on it, especially when I could bring it to my platform. I could speak a little bit about some mental illnesses that I have been dealing with. In particular, dealing with loss of loved ones. I think that's something that all of us will experience. And how do we go about dealing with those types of losses? But I would be remiss if I tried to do this pod by myself. I think I could shed a lot of light on, certain aspects of the subject, but I thought it would be good to bring someone that is a bit more credible than me, right? I have a friend on the pod today, actually our first guest. So welcome. She is going. I'm excited. I'm happy to finally introduce the first guest. This is a friend of mine. We actually have known each other for the majority of our lives. We grew up in our church together. I think we went to elementary school together, something like that. It could be wrong. Maybe not. But I want to welcome to the Myles High Pod Dr. Davina Knowles. She is a professional psychiatrist, someone who is well-versed in the field and the subject that we're going to be talking about today. So Davina, welcome to the Myles High Pod.
Thank you so much for having me, Myles, but as I affectionately call you, Charo.
Sure.
So getting used to that. I am a mental health professional, a psychiatrist by profession. I started out in the Bahamas, lived here most of my life, went to school in Canada at Dalhousie University, Nova Scotia, where I got a Bachelor's of Science degree. Mm-hmm. Transitioned to St. Augustine's, Trinidad, where I obtained my medical degree. I came back home, did my clinical practice. Been at the mental health hospital here, Sandilands Rehabilitation Center, for the last 7 years, where I've worked in different areas of mental health, which includes males, females, forensics, children, substance abuse, the elderly, geriatrics. So a whole plethora of different fields in psychiatry. So during that whole 7 years, I obtained my doctorate of medicine in psychiatry, doing my residency program. So completed, qualified, specialist.
Congratulations, man.
Thank you.
Actually recently became a doctor, right?
No, became a psychiatrist.
So
I completed my medical school degree in 2015.
That's right. Yes.
Right.
But recently became a psychiatrist.
Correct.
Absolutely. So let's go back to the beginning, right? Because like I say, I've known you for quite some time, and I know that this field wasn't the initial or the first field that you wanted to get into, right? So let's go back. Let's like, how was your upbringing? Like, what did you initially want to do as a profession, and how did you get into this particular field?
You're very much correct. So initially when I started out and went to school in Canada, my original path was to be a dentist, an orthodontist specifically. Like I remember writing in a primary school entry that I wanted to be an orthodontist from probably before I kind of knew myself. And I think we're going to talk about it a little bit more because you spoke about loss. Mm-hmm. I too have lost a parent at a very young age. At 14, my mom, she passed away from breast cancer. So when I was supposed to go to dental school, I transitioned in my first year from dentist to doctor, general practice, with the intention of becoming an oncologist, obviously to, go in the field that kind of took my mom's life, right. Help people, help others with that type of issue. So when I was doing my clinical practice in the Bahamas at the Princess Margaret Hospital here, I didn't really feel as passionate about that specialty, as it were. I didn't really see that was where I was called to be. So I know you spoke about purpose. And so I prayed about it, and I was like, I don't really think that this is a right fit for me. And I wanted to go into women's oncology, which is like more like the ovaries, the uterus, that type of thing. So I was supposed to go to Freeport, which is another island in the Bahamas, the day after internship. And again, it was just like, I'm supposed to be there, but I don't really feel like that's where I'm supposed to be. And so I called the director of the psychiatry department here in the Bahamas. And I was like, I know it's the day before my transition from internship to general practice. Do you guys have any spots left? And she was like, yeah, we'll take you. And even in that journey with mental health, it was a lot of stigma even within the profession.
Right.
A lot of people say that, oh, you're the crazy doctor because you go to work with quote unquote crazy people. It was a very big stigma, it's still a very big stigma against mental health, which is very strange to me because, I mean, it's very important, right? But yeah, there was a lot of stigma against me choosing psychiatry as a profession because people were like, why would you waste your brain? You're, one of the smartest. You could be such a better doctor, in their words, like use your talents for better or whatever. But I was like, you know what? I feel drawn to this area. Like, this is where there's a need. It isn't fulfilled. A lot of people weren't passing the psychiatry program at the time. And like I said, there was a very high stigma against mental health. Mm-hmm. So I did feel drawn to going in that area. So I I went into the program at the University of the West Indies for psychiatry and finished on track, on time, in light of the pandemic, which kind of pushed us back 6 months, but still on target. And so that's kind of where I came in.
Yeah, absolutely. And I like I said, I've seen the journey. Like, I remember when you went off to study dentistry, specifically orthodontistry, and obviously, the story of your mother passing. We'll get to that in a couple of minutes. But then you transition to oncology, and I think that's like pretty normal, right? You have you experience some trauma or some loss, in a sense, and it changes the trajectory of your life, right? And you kind of move into something, I guess you could say, off of emotions, but sometimes it's warranted, and it's just something like, man, if I had known this, I could have done this, like that type of feel.
Right.
And then transitioning into psychiatry and becoming a psychiatrist, and you and I have spoken quite a bit on like the stories and your experience to this point. But before we get into the experience, I wanted to kind of define mental health and mental illness first, just as a foundation, because like you said, there's a stigma when it comes to mental health, mental illness, and there are a lot of people who hesitate from discussing whether they have mental health issues because people will call them crazy, or there'll just be this negative stigma behind it. So let's define what mental health is, or mental illness is, as a foundation for what we want to discuss.
Okay, sounds good. So I like to say mental health is health, right? Because I like to use analogies as well. When you think of a car, right, you think of the shiny object on the outside, but your car can't go without your engine. And the same way, we as humans, we can't go without our brain, right? Mm-hmm. So mental health is health. And as a med student, we learned first, you can't know what abnormal is until you know how to examine what normal is.
Absolutely.
So in terms of mental health, the normal aspect of mental health, it is a very big umbrella. It encompasses things like the way that you eat, your moods, so happy, sad, angry, irritable. It encompasses things like not being in touch with reality, things like substance use, that type of thing. And you spoke about trauma, so it does include that as well. So when you talk about mental health illness, similar to physical illness, if you have too much sugar or you have too little sugar, those are abnormal things. Those are pathologic. Everybody has a blood pressure. So you have high blood pressure and you have low blood pressure. And once it's not in the middle, that's when you have an illness. Right. So the same for mental illness. There's normal feelings of sadness, there's normal feelings of anger, there's normal feelings of feeling irritable. So we have things under the umbrella of mental health that include things like mood disorders, right? So there's highs and lows. So we call the highs bipolar disorder, where it's, your manic phase, where you get very irritable. Some symptoms include lack of sleep, not wanting to do too much things where is in keeping with reality. So you're easily distracted, your thoughts are going really fast, you have a lot of goals, you want to do a lot of things at once. Persons may engage in risky behaviors. And so if those things, and so in psychiatry we use timelines too. So with bipolar illness, if you are in the manic phase, if you see these symptoms over a week, then we're saying you're having a manic episode in your bipolar disorder, right? Mm-hmm. And then opposite to that is the low poles, and so we call that depression. And so depression has different severities. So you have medium, high, severe, etc. And so the symptoms for that would include, depressed mood, obviously lowness. Some people, or younger folks, we might see them become a little bit more irritable. So it's not as they're like walking around with a somber face. We talk about eating. So if they're eating too much or eating too little, sleeping too much, sleeping too little, feeling hopeless, not being able to concentrate, having low energy, and the taboo thing, asking about suicide, right? The thoughts about wanting to end your life, thoughts to want to harm yourself, not wanting to be around. And when I say taboo, is that people don't like talking about it. But the thing about it, how can you address something if you don't talk about
Absolutely.
it? So those are the spheres of mood illnesses. Then we have things like psychotic illnesses that people talk about, schizophrenia. So when we say psychosis, that's just a fancy term of being not in touch with reality. So they can be saying things, acting abnormally. They talk about hallucinations. So people that hear, see, feel, so all of the different senses that they themselves are experiencing as their reality, but those around them not really seeing that as much as the reality around them. Mm-hmm. Delusions, again, not being in touch with reality. So thinking as though people are out to get them. So we call that paranoia, thinking that someone's in love with them. So grandiose, or erotomanic, right? Or having these high powers. That's the grandiose delusions, where they think that, they could be the prime minister or the queen, that type of thing. So all of those things fall under, psychosis. And then we have eating disorders, so bulimia, anorexia. People think, or body dysmorphic disorders, when they think that, they're too skinny, they're too big, and so they're trying to do all these different things to try to lose the weight. So you see them either popping pills or like laxatives in order to like have a good pass, or excessively working out in the gym. And so like I said, there's normal and there's abnormal. So if you see this person who's clearly underweight, but in their mind, they're looking in the mirror and they're saying, well, you know what, I'm overweight. So they're in the gym 24/7. They're not going to work because they feel like they have to lose this weight. That's a disorder, right? Then we talk about things like personality. So people use the term that's, you have, you're antisocial, which for us, we use the DSM-5, right? So the Diagnostic Statistical Manual. And we're on the 5th edition, so we spoke about you saying that, mental health has been around for over 2,000 years. So over the course of time, the manual has kind of evolved. Mm-hmm. So we say that the disorder comes about because it's not in keeping with cultural or societal norms. So in certain cultures, like I guess Chinese versus the Bahamian culture, things might not be the same. So we wouldn't classify that as a disorder, right? In the Bahamas, for example, people are very religious. We consider ourselves a Christian nation, as it were. So that means some people would talk about, they hear the voice of God, but in the church setting, we're not going to be like, oh, you have a mental illness, you're having an hallucination. So it's like when it's too excessive and is not in keeping with this culture, then, that's the illness. So in terms of like the personality disorders, those are things that are kind of embedded in the person, who they are, and they kind of classify them in different clusters. So for example, there's the odd kind of people that kind of is in their personality. Then there's the eccentric people. So I spoke about the antisocial type of thing. That to the layman person would mean, somebody who doesn't want to be out in crowds. But to me as a psychiatrist, if you say you have an antisocial personality disorder, those are persons, 80 to 95% of them are imprisoned because they have lack of remorse. They don't have regard for other persons. They steal, that type of thing.
So antisocial, because I consider myself on a low scale, I guess, to be like super antisocial, right? And I think it has a lot to do with me being more of an introvert.
Right.
So like I don't necessarily feel comfortable in like large crowds, or
Right.
feel comfortable like talking to like people I don't know, or like I'm
Right.
not close to or whatever. So is that considered to
No,
be,
those two things are totally
Okay.
different. So that's you being less sociable as opposed to having an antisocial personality
Gotcha,
disorder,
okay.
where that is a completely different thing. Yeah.
Okay. All right. So I guess a lot of the so we can conclude that there are many types of mental illnesses, right?
Correct.
And they vary on a drastic scale, like from I guess low
Severity.
low severity to high
Right.
severity.
Right.
Correct. And I guess in identifying and recognizing the signs or symptoms of these varying mental illnesses, I'm sure that varies from person to person, and this is the low severity and high severity of the scale that they vary on, right?
Right.
So let's I guess I want to jump into a personal conversation now, because we've discussed the types of mental illnesses. So I want to just talk about one that can bring on mental disorders within person, right? And that's dealing with loss. Like you've lost your mother much earlier than I lost my parents. You lost your mother at the age of 14. I lost my parents at the age of 29. But I would assume that the impact, regardless of the age of the individual, could be severe, based on like the relationships, the connections, where this person is in their life, how mature they are and whatnot. So just, I know what my experience is, and I'll kind of give my experience throughout this particular podcast. But how was it for you, like at 14? Because obviously I don't think you would have known anything about mental health at the time. But looking back with the knowledge and experience that you have now, how did losing your mother at the age of 14 affect you mentally?
So you spoke about something that's very significant as it relates to mental health, right? So we talk about different things that could affect mental health. And so one of those things are stressors, so environmental things. Mm-hmm. So the loss of a parent can induce different types of illnesses like depression, anxiety, post-traumatic stress, depending on how you might have lost that parent. Things like genetics can predispose somebody. So if you had a relative, like a close family member, like a father or mother who had a mental illness, like depression, you're more predisposed or more likely to develop a mental illness. Things like drugs. People don't think, in our culture, they say if you smoke weed, if you're laced, then you're going to get a mental illness. You can act crazy. And I don't like the word crazy because that's not really a good term. Right, it's not endearing at all. So
how so? Let's lean in on that.
So because it's derogatory, like when we spoke about stigma, it doesn't. If someone called you crazy, are you going to be likely to try to get help or assistance for that illness? We don't call somebody that has diabetes crazy or a derogatory term because of their illness. You don't ask for an illness to happen to you. It just happens to you regardless of, your situation, your circumstances, your genetics. If you used a substance like marijuana that does have hallucinogenic properties. So some people could smoke marijuana one day and trip versus someone who smoked 100 times, never tripped, and then the 101st time is now predisposed to that mental illness because of the increase in chemicals or their situation at the time of them smoking. Right? So yeah, we don't try to use derogatory terms
Gotcha.
to define mental illness. So breaking stigma is very important. Circling back to me in terms of my mental health, there were definitely a lot of significant, as it were, traumas in my life. Not just with my mom, but just generally in terms of financial situations with my parents. And I guess one of the bigger ones at the time was my mom passing. I think at the moment, now they say retrospect, hindsight is 20/20. I think there wasn't enough done as it related to the traumas or the different situations that happened for me and my siblings when we were younger. But again, to your point, I don't think that mental health was at the forefront of a lot of Black homes. In the Bahamas, not a lot of Christian homes, not a lot of Bahamian. It was a very taboo topic. So now to say that you're going to take your 14, 10, 9-year-olds to go get counseling, why? We can take them to church. But the reality of it is we probably did need some form of therapy to get us over the hump, because we did then use different outlets, my brother, sister, and I, to overcome that trauma. Dealing with, so with me personally, my mom had a chronic illness. She found a lump in her breast. We were moving to the States at the time. She found the lump, and we just decided to stay there for her to get medical attention. Her cancer was very aggressive, so she underwent chemotherapy and radiation. The chemotherapy, she would call it, killed her faster. Like, I would see times when my mom would be in the bathroom, and we lived in a home where their wing was way further than ours. And so I could hear her retching and vomiting. And so it's just like, that tugs at your heart, your heartstrings as a child, because you know there's nothing you can do to help her. And so she fought. We had family members come over. She underwent the chemotherapy and the radiation, like I said. They thought they got it all. Life happened as it pertained to other relatives and other things in my life that I won't kind of share on now, but it definitely, other life events happened during that time. Moved back to the Bahamas. She found another lump. So at that time, she had said that she didn't want to undergo any more treatment because she felt as though it killed her faster. It was so hard on her body to even go through any more treatment. So she made the decision for herself that she didn't want to undergo chemotherapy anymore, or radiation. Life happens again. And so the lump or the cancer, the medical term, metastasized. It spread. She inevitably ended up having cancer throughout her body. And the final straw was having a tumor on her spine, which was the size of like a grapefruit, to the point of her being in and out of hospital. And during that period, another life event happened. So my dad wasn't there for about 2 years. And so I was, the person taking care of my mom, along with my grandmother, who ended up having Alzheimer's, her mom. So. And
at this point, you're what age?
12, 13.
Okay.
So taking care of, obviously, mental health, again, dementia is a part of mental health. So we call that major neurocognitive disorder, where it falls under the umbrella of dementia and those dementia-like illnesses. And so dealing with a grandmother who didn't know who we were, essentially, a lot of the times, and a mom who didn't want to tell anybody else that she was undergoing a relapse, was kind of a burden for a 12, 13-year-old. I had to definitely grow up really quickly. My dad came back, and my mom said she was literally holding on for him to come back. And when he came back, when I tell you, it was like a wildfire. Like when you're just like spraying a wildfire with a spritz bottle, and then it finally has time to like explode. And so the cancer had already like essentially taken over her body. I remember one of the last times she went into the hospital, she was telling the nurses that, hey, I have this pain. Can you guys give me some assistance? Whatever ended up happening, she ended up being paralyzed. So for a month, my mom was almost in hospice care at home in a bed, a hospital bed. We were taking care of my mom, and she essentially told me, like, I'm done. And so I say all of that to say that that was a very traumatic experience for a 12-year-old to have never gone through therapy. At the time, like you said, you don't know that it's traumatic. It's just life, right? You don't have somebody to share with. You don't have somebody to express, like, these are ways that you can cope with stress. this is your normality. Like, this is who you are, and this is what forms you. So I say all that to then say, I guess it did shape me into who I am, and understanding the importance of having somebody to talk to, having someone who's removed from your living situation that can give tips and tools to assist with, those struggles.
So you say your family said that, like, that period of time, they didn't think, like, I guess a counselor was needed. I guess they looked at it as, let's go to church, right?
I don't, and it was never said. I think my dad in recent times has said that's one of the things that he regretted, not letting us talk to somebody. But I think it wasn't a go-to for any Bahamian household to say, well, you should take them to counseling, you should take them to a therapist. They probably went through a lot, like, offer those services.
And you think that's changed now? Do you think Bahamian homes, black homes, not just even in the Bahamas, just globally, do you think our community is more open now to counseling?
There's still definitely a stigma. I talk about the pandemic being one of those things that kind of broke the mold a little bit, because I think the pandemic helped people kind of normalize needing somebody, needing an outlet, needing, even if it's just talk therapy, right? And I joke with a lot of my colleagues where it's like people have normalized the fact that, hey, I have a therapist. I think that's like Gen Z thing. Like, you know what? I talked to my therapist about this. And I think social media has kind of given us that okay to have somebody to talk to, somebody that I get meds from. And it's kind of broken that taboo. Our culture is a bit slower to that, but I think it is kind of progressing into it.
Yeah, I think it's great, though, because you do hear a lot of people talk about, they're going to talk to their therapist, or I see my therapist once a week or twice a week. And I do think it's something that's necessary, right? And, back to like your experience, like I'm sure there are tons of persons out there who, you deal with these traumatic experiences when it comes to like, how it affects our mental health, right? And you have like persons like you who it's like it's an ongoing trauma, right? Because how old were you when your mother was first diagnosed? 12, 11, around there. So like I said, very progressive. Like it happened very quickly. Okay. So she was diagnosed, and in 2-3 years she was deceased. She passed. So, you had a 2 to 3 year period where like a lot was thrown at you as an 11, 12-year-old, right? And you had to watch like this traumatic experience happen. This person that you loved and that you cared for, like you had to see them on a daily basis, like the struggles that they had, the things that they had to go through, and that in and of itself is traumatic, right? And then on the other spectrum, you have someone like myself who, my parents, for the most part, like, we're never sick. We're never in hospital. We were a close-knit family. We kind of did a lot of things together. And it's especially, around the time, like I was 29, like I said. So my parents and I, specifically because I was, back home working with my parents, so I would see them on a daily basis. We'd be communicating on a more consistent basis, right? So our relationship, my relationship with them grew, specifically within that 5-year period. And what happened to me was like overnight, right? So got a call, we don't know what the story is, but there's a plane that crashed, and keep in mind I'm working at the time, right? My dad was on his way to, we were having a conference in Grand Bahama, another island in the Bahamas, and it's an annual conference that we have every year. We had actually had it, I think this was the first year, if I can remember correctly, that was the first year we were moving it to Freeport. So there was like this excitement that we were having, just something new, something refreshing, for the event, for the conference and all of that. So I went up in advance. I went up a few days earlier to the start of the conference, and my dad was following with my parents. So I was there was communicating with my dad the whole time over the phone. Let's fast forward to, that Sunday evening Sunday afternoon, I should say. where everything expired, right? Where plane crashed, my parents passed, along with, a lot of other different people, my uncle and, some family friends. And like, I could remember like no one knowing what to say, right? Like everyone was like, man, like, and I'm sure like everyone, like, like in retrospect, like I could look outside of myself and look at everyone who was around at the time and just imagine like how did this loss affect everyone? Because like you could see it, right? Because like some people were numb and just couldn't move, couldn't say anything. They were like super emotional. And you had others who were like just trying to be comforting to the family and, trying to do their best to say what they feel needed to be said. And like one particular thing I could remember, and in speaking to like giving people the opportunity to speak to a counselor, right? Like that happened immediately for us. But my experience wasn't good, right? So I do feel like counseling is needed, but I think it needs to be something where like you're giving the person or like you're speaking to the individual first. Like you're telling them like, this is what I think we need to do. How do you feel about it, right? Because we didn't get that opportunity. Like all they did, it was my sister, myself, my aunt. I think my cousins were there, who were the son and daughter of my uncle who passed as well. All of us were brought into a room, the room that we were staying in at the time, and they brought like this counselor. I can't remember if it was a grief counselor, and I don't want to really call any names just because of like the experience that I had and the effect that it had on me, right? So this is, the accident happened Sunday night. This is the next day. So this is literally less than 24 hours beyond my parents passing, right? We sit in this room, the grief counselors, or the counselors, I'm assuming it was a grief counselor. And they were just saying things like, we have to release this from us and we have to let this go. They wanted us to mimic them, like lift your hands up. And when you turn your hands over, I want you to release your parents and like allow them to go. Like, so imagine like my reaction and my response, right? First of all, like I am super pissed that my parents passed. Right. Then I am now even more pissed that y'all don't even want me to, like I'm not even being asked like how I am doing, right? I'm being asked to like release this, just
release
like
them,
let it go.
Essentially in your mind, probably at the time too.
Like accept the fact and like move on and get over with it.
You brought up a very good point, because clearly that person's not a grief counselor either, because there are stages of grief,
Absolutely.
right? And the first one is in acceptance. That's definitely the last. Mm-hmm. And so like there are different phases that one needs to go through and process. And there's no, and like I tell my patients all the time, I have no rule book or time book, because every person is different. Mm-hmm. So how you may deal or cope with a situation might not be how the next person. So to even say that the counseling that you did receive was only in a group session was kind of poor too.
Absolutely.
So that segues into the next issue in terms of treatment. And there are different treatment modalities, even as it pertains to counseling. So there is grief counseling, there's exposure, there's desensitization, there's something called cognitive behavioral therapy, where you like try to rework people's thinking and their actions, and dialectical behavioral therapy, where the person's more engrossed in doing things, right? So even with that, there are different types of treatment.
Right.
Some needs to be more individualized versus group, right? And the timeline varies depending on what type you're getting.
No, I think the timeline was important, especially for me though, because like I say, like it was just so unexpected, and I think I needed time to sit, or even like someone to come to me and tell me like, this is what we're thinking about. Like, how do you guys feel about it? Right. I feel like allowing me, because I wasn't 12 or 11 like you, right? I was an adult at that point. So I think giving me the opportunity to make the decision whether I wanted to be a part of it, and I just went through with it just out of respect for the people involved, right? Because I knew that they meant well. I knew that they were trying to help, right? Definitely going about it the wrong way, and I think it affected my openness to counsel, right? Like right after, because I remember like leaving the meeting, like once we left that session, I went to my aunt And I was like, look, let me tell you something. I am never doing this again. If anyone comes to me and talk about they want me to speak to a counselor or do whatever, I'm not interested. I let you all know now. So don't come to me, don't ask me. And even like to this day, my wife and I, we have conversations about it, knowing that, and I've talked to a few people since then, but I probably should have, more consistent conversations, right? Because I think it's important to unpack like these emotions that are probably now built a wall up of, just because of, dealing with that traumatic experience and then going right into that session, which was another traumatic experience that didn't feel good for me, right? And I guess could imagine like how much times that happens on a day-to-day basis where people are trying to help, right? But they're not helping.
So you say something that we have in our culture that says the road to hell is paved with good intentions. So people are trying to do something good, but then it falls short, right? I'm very sad for your experience because in reality, it has to be based on the person's willingness. Because I can give you another saying that we use quite frequently. You can lead a horse to the well, but you can't make it drink. Mm-hmm. So the reality of it is important. I could say how important it is for you to get this therapy, to do this thing. But if you don't want to do it, then it's kind of pointless. And so therapeutic alliance is what we talk about too, the relationship you have with your therapist and different factors that might deter you from wanting to get that help. Having a bad experience. So in your situation, the analogy that I would use would be, I'm pretty sure you know how to ride a bike. Mm-hmm. The first time you fell down off the bike, did that stop you from riding the bike?
No.
You continue to ride the bike. Mm-hmm. So that doesn't mean maybe the bike that you had wasn't the right bike for you, mm-hmm. or maybe you didn't have the equipment that you needed to ride that bike. Maybe you were too short, you had needed a longer, bigger bike, etc. So in the same way, that therapy session was not the right session Absolutely. For you. So maybe you need to find a therapist or somebody or the type of therapy mm-hmm. that you do need that might be the better fit for you.
Yeah, I'm sharing that experience because I'm sure that happens like right. a lot of the time, and I just I want everyone to know like none of us are immune to like these different traumatic experiences, right? And again, we're just talking about like one aspect of mental illness, right? Trauma, depression, like loss, like all of these. Well, that aspect that affects each of us differently at different stages in our lives. Like yours was much earlier than mine was. But like in recognizing like the signs or the symptoms that we see, right? Because the older that I've gotten, I've now started to realize like I've always been dealing with or been observing like my friends and family who have been dealing with mental illness. And it's not like drastic to say like this is a severe case, but it's just like little signs where, man, like that probably could have been recognized and a conversation could have been had or a suggestion could have been made, right?
Right.
So this, my question is twofold. Like how do we, what are the signs to look for, right? Like and that may be an unfair question to ask because there are so many types of mental illnesses,
Correct.
Right? But to the best of your ability, like how do we recognize the varying signs? And then like what can we do as friends and family members to assist those around us who are displaying these signs?
So like you did mention, that is a very heavy question. It's very loaded because like I started out, mental health is a very big umbrella. It encompasses a lot of things, right? But the key is to know what normal is and then kind of veer towards what abnormal, right? Because until you know what normal is, everything's going to seem abnormal. So and then I would assume that normal would vary from individual to individual as well. So we
right?
use social and cultural as the golden standard
okay.
in terms of psychiatry, right? So what's normal for your culture, what's normal for your society as a whole? And then we kind of segue. The biggest, I guess, red flags or indicators of having mental illnesses, something that I ask the family members or the people that are bringing the person in, if they're not coming alone, patterns in sleep and patterns in appetite. Like those, I would ask those two questions probably 100% of any interview, because you can tell a lot about a person's sleep pattern, and most of the DSM-5 diagnoses include some pattern of sleep that has changed. So if you start to notice that your relative or your loved one or whomever is up all through the night, they're not sleeping, or they're sleeping too much, those are typically a red flag. Like, to say, okay, well, why is that person doing that? And like you mentioned, it could be small little things that you notice. So changes in their behaviors and their patterns could indicate, well, that's a little abnormal. This person wasn't doing this a few weeks ago. And then either bringing them in or convincing them that they might need some help.
But how does a conversation happen though, right? Because like I remember like when I lost my parents, I literally remember like I don't know if I ate for 2 weeks.
So right? Changes in appetite.
No, absolutely, right?
Right.
And I know I definitely wasn't sleeping well, but like I don't remember like eating for like 2 to 3 weeks. And there were a lot of people, during that time, like everyone is cooking and bringing food to assist like with the family or whatever. But it was just difficult. Like you didn't have an appetite and whatnot, right? So when you recognize that, like, how do you have the conversation? Like, do you sit down and be, because I'm obviously it depends on your personal relationship with that individual and the level of comfort that they have with that type of conversation possibly. But like, what would your suggestion be as far as like trying to convince them? Like what are ways or things that can be said to convince them to at least have a conversation with someone?
So as a part of psychiatry, in terms of our physical examination, we use something called the mental status examination, right? And a part of that includes the insight. So some people might have insight to their illness, meaning that they understand that, hey, I do recognize that I'm having these changes. And so those people you might be able to convince and say, well, you've been doing this. Your behavior, you were putting, I guess, tires in the refrigerator, something like that, right? I mean, that's obviously a far stretch. But like you've been doing X, Y, and Z thing, and you might be able to convince that person that, hey, I think I know of a person that you may be able to talk to. This seems a little bit abnormal. Maybe they could do an assessment on you and see, and we could go from there with if there is something that we need to be concerned about versus there isn't, right? Then those are people that lack insight, so they don't think that there's anything wrong with them. They're like floridly ill, they're acutely sick. Those type of persons may need a little bit more assistance. So it's not going to be a, hey, I need to take you to the doctor right quick. It might be, hey, let me call the ambulance, let me call the police, let me get some extra assistance to get this person there, especially if they're either a threat to themselves or others, because you don't want it to linger on too long.
And what about persons that may be in denial or hesitant, right? Because like you said, there's a stigma behind like dealing with mental health, right? So I approached one of my friends and we're like, hey bro, look, I've been seeing some signs of things that just doesn't look too normal for me, at least based off what my normal would be for you. And like, I just want us to go have a conversation with someone, right? And would you suggest taking them to the counselors or therapists or psychiatrist's office, or bringing the psychiatrist to them? Or is it one of those things where like, tell me what you're comfortable with and we'll kind of make it happen?
I think it depends on the conversation and their intellect too, and their willingness to want to get treatment. It might need a little bit more convincing than that one-off conversation with them. But you don't want to be too forceful, especially if they're not like a threat to themselves or others, because to your point, when you were fully immersed in that situation, that completely turned you off. So you don't want one of those situations either. So if it's something like that where you feel like it's somebody that you're friendly with, you don't want to uncheck it either. So you don't want to be like, well, I'm sticking my head in the sand and ignoring these things. Being like upfront, hey, I've seen that you've done X, Y, and Z thing. Maybe we need to talk to somebody. Maybe you could go by yourself. I think it'll be confidential. I know this person. This person's recommended. I think this person might be suited for you. Just give it a try. Something that we didn't talk about but is very important. Sometimes general medical conditions can mimic mental health illnesses too. So what we routinely do, at least for me, making sure that that person gets a wellness check in terms of, their laboratory investigation. So things like there's this gland in the neck called the thyroid. If it is pushing out too many hormones, then that can cause you to become what we call manic. And if it has too little, it can cause you to be depressed. So like working out and making sure that you're not having a medical condition, something like a STI or a brain tumor or something like that, that could influence this strange behavior, this mood, is very important too. So making sure that they go to see their general practitioner is also very important.
So there are medical conditions that can cause mental illnesses.
Correct.
Wow.
The great mimickers. So
Wow.
it's very important that, you know, holistically you're checking up on everything.
Okay. All right. Didn't know that. And, you know, I think this is a good point just to mention to everyone out there. Like, check on your friends, man. Like, I have friends that at the least, like, I'd send them a text just to find out, like, make sure they're doing well. How are you doing? Like, what's going on? And I'm talking like friends that you know are going through situations.
Your
right?
strong friends.
Yeah,
right?
yeah.
Because people say, you know, I didn't think that this person was going to commit suicide. Because it's your strong friends, like the people that you think, oh, they have it all good. They have it all together. Okay, but they don't. Like, because everybody's going through something and everybody's dealing with those stressors differently.
And so even with, like, since you brought up like strong or people who appear to be stronger than others, right? I'm sure that there are signs that they show as well.
Correct.
And they may be better at hiding it to certain people, but like how do you assist them? How do you help them? What are signs that you look for with persons that you may think are stronger? Because I would consider to be, and you know what? Let's have this conversation, right? Because when I was going through the depression of dealing with my parents, like I got to the point where I wasn't suicidal, but I understood how people get to that point, right? Like I understood asking yourself, like, do I really want to like be here? Like continue to go through this, continue to feel these feelings and go through these emotions. Like I could remember specifically, it was a morning. I was in the shower and I was just kind of, this might have been like 2 days later, 2 days after my parents had passed. And I just remember like thinking and talking to myself and just being like, boy, I just remember saying like, boy, I get it now. Like I truly get it now. Because prior to that, my question would always used to be like, but how people is get to the point where they
wanted to end.
Yeah, they wanted to end, right? And for me, it was like, wow, I get it now. Like I get how you could get to that point, right? And I think the difference is, well, maybe not the difference. Let me not say that, but I think the strength for me was I had a good spiritual foundation, right? And I think that assisted me a lot when those thoughts came about, right? But you have a lot of people who aren't there. So, you know, going back to like those strong individuals or people who appear to be strong, like how do we, like what can we do? Like how can we help?
So first and foremost is breaking the stigma, right? Understanding that mental health is important and it's just not persons that are crazy, right? Stop using derogatory terms, thinking that it's essential to get help, right? So once we normalize wellness checks, so just as you go for a physical, it's okay to go to your therapist and get a mental wellness check. Then after the stigma is kind of minimized, understanding the signs. So for other outside lay people to understand that, hey, this person has become more secluded, reclusive. They're not as social as they once were. Like maybe, like you said, I'm checking up on them a little bit more frequently, giving them a little bit more tips and tools. Hey, I see that you're not engaging in these hobbies because that's something that they probably pull back because they're feeling too stressed. They're not as sociable. They're not going out as much. So kind of like going over to them, making sure, hey, did you eat today? Checking up. How have you been sleeping? We talk about sleep hygiene in therapy too, like tips and tools so that you can get better in that regard. And just noticing the signs. So like I spoke about with depression, changes in sleep, changes in appetite, concentration. So they're not performing as well on the job. Their energy seems a little bit less than normal. And normalizing having the conversation about suicide. So saying that talking about suicide is okay. Asking, the general practitioner could even ask, have you been having these self-harm thoughts, wanting to end your life? And to your point, not everybody is saying that I want to end my life, but they're saying, you know, I don't want to be here anymore. And that could be a red flag to say they might not be suicidal, but they have no interest to live. So recognizing those signs and saying, well, convincing or trying to help and build that insight with those persons and say, well, we have somebody that we could talk to. And to your point, even maybe bringing that person in. Like, I have this person, you may be able to talk to them. It might not be a good fit, but at least hear out what they have to say. Maybe they continue, maybe they don't, maybe they see somebody else, but at least it opens the door. But not just sticking your head in the sand and pretending that you didn't see it.
Right. And I think that's the main thing, right? Don't ignore the signs.
Right.
Because I think for years, especially our community, meaning the Black community, like we ignore signs. Like we just say, oh, this person just needs to, like, he just hungry, or he just having a bad day, when like, no, like this, it's a little more drastic than that, and there may need to be a conversation that need to be had. So I wanted to ask a question, right? And I think because like mental health has come so much to the forefront in of discussion, especially, you know, amongst our generation and the Gen Zs, right? And they're much more comfortable having a conversation now. Like, should society change its view on mental health and mental illnesses?
Of course, because that helps with breaking the stigma and normalizing it.
So what changes do you think could or should be made?
The first, social media platforms that discuss, normalize it, make it like an everyday conversation. Me, you chilling. Why aren't we talking about mental health more? Why aren't we saying that this is something normal? Everybody experiences something. So everybody goes through something. Everybody's dealing with something. How do we deal with it better, right? Normalizing that conversation, putting out PSAs, putting it out on social media to say that this is what I'm going through, or this is how I can get help for X, Y, and Z thing. Next month, May, is Mental Health Month. So bringing awareness to the different disorders.
This month, is
right,
Mental Health Month. Yeah, funny that you mentioned that. This month is Mental Health Month. That's part of the reason why I wanted to have this discussion, right?
Right.
Because I think it is important. Yeah, go ahead.
Right. So bringing awareness, I think, is the first and foremost. So breaking the stigma and making sure people are aware of different signs and symptoms. And once you are aware, I think that brings in the normalcy of getting the help that is needed. Because other people, oh, my favorite celebrity is doing X, Y, and thing. They're okay. They're getting help. Why can't I?
And you think that the fact that celebrities are having that discussion is a good thing then?
I do, because I mean, obviously we live in a social media world, and that's the reality right now, that people want to live the life that they see on TV, live that life that they see on Instagram. If it's normalized to the point of, okay, well, I see this person doing it and they're living a healthy, productive life, then so can I. Because normal people have mental illnesses. Normal people have sicknesses. So why do you think that you too can't be?
No, 100%. I think a lot of us deal with mental health issues on a daily basis, right? And I think it comes and goes. And I think the way, just as much as you work on your health, I think you should be working on your mental health. Because like you say, mental health is health.
Right.
Right? And I think they are one and the same. Man, this has been a great conversation. I want to thank you for coming.
Thank you for having me.
For sharing.
We have questions.
Oh,
I'm sorry. But I mean, you could have just jumped in the conversation. Nah, this has been a good conversation though. But that's my wife, you know, being bossy as usual. But she has a question that she wants to.
I have questions.
Yep.
Yes.
She has questions.
You want me to list all of them or go around?
Let's go one by one.
Okay, so the first one is, how do you know when you need a therapist versus a psychiatrist?
okay. So I published, or not published, I posted something actually recently that spoke about who needs a psychiatrist. Everybody needs a psychiatrist, because I spoke about it earlier where it was, we do wellness checks. So it's not just, you know, the pathology. Everybody could use, you know, a therapist to talk to make sure that everything is going okay. So everybody.
The second one, I think we touched a little about it, is about church and how a lot of times in our society, because we are a Christian nation, people think that church heals everything and just what do you pastor. And we know Jesus is our source and have faith in all these things, but how do we get that mindset to change to say, well, we need a little while to just go into a church pastor. We need, an extra step.
Perfect question, because I say this all the time. Faith without works is dead.
Absolutely.
So God gave us, the knowledge, the know-how to make medications, to help heal people. And that comes from a physical standpoint and a mental standpoint. So there were medications created from the ground, from the earth, herbalistic, that can help people. So God gave us the know-how to help. So without the faith and the works is, you doing your part, you going to your therapist, you taking your medication. You could pray about it all you want, but if you don't put in the works, meaning doing your part to help heal yourself, then you're going to be in a worse state than you are now.
Yeah, I think too, when we're talking about like faith, and there is a negative stigma when it comes to mental health, and mental health is illnesses in the Christian community, right? Because everyone thinks that you could pray it away. Like, oh my goodness, I can't tell you the amount of times I've heard, like, just pray for
it. Makes me cringe, honestly. Like, I do get cringy because I am a Christian, right? I do believe in God. And so, like, I do believe in, going to church and believing in healing and believing in the power of prayer. But at the same time, you're not supposed to be stupid. God didn't put us here to be foolish. Mm-hmm. So there are advances in medicine, advances in, our life that we should use and take advantage of.
Right, because you get a cold, right? You ain't gonna just say, oh, let me pray this cold away. Like, you go into the store, you're gonna buy some Buckleys for all my BMAs. Y'all know what Buckleys is. You're gonna buy some Robitussin, some Theraflu. Like, you're gonna
try
get some medication to try and
faith with work. Put that work in.
You're going to have faith with works, right? You're going to pray that the cold leaves, but you're also going to get some medication.
Do your part to feel better.
I think mental health is the same way.
Right. Yeah. I agree.
Mm-hmm.
My next question is, I've read a lot of things about Black women mental health specifically, and how we are diagnosed or we are misdiagnosed. And some signs can be irritability, anger, anxiety. And so how do you ensure that you go to someone who is specifically going to cater to the needs of Black people or Black women, so we're not misdiagnosed for these things are best?
So very important question, because that's going to segue me into something, I guess, that we really don't have time to talk about. But something that we didn't really hit on was, female mental health, and more specifically postpartum depression, things that affect women on an exponential rate because it's typically missed. Short story, but it can be longer. But as it pertained to me, I had a baby in the States, my 4-year-old son. And
what's up, Cairo?
And I say that because during that time, there was a lot of things. I think Serena just had her kid too, or after. And a lot of things were in the media about Black women specifically, and as it pertained to medical care. And in that same vein, it is known that Black women don't receive the necessary care because it's thought, which is crazy to me when you hear it until you experience it, that our pain and threshold levels are different.
Higher, yeah.
I had an epidural. I am a doctor. So they placed the epidural and it was failing, right? And I'm telling the anesthetist, like, hey, I think that it's moving, et cetera, et cetera. So they gave me more medications. And this happened over the course of several hours, where this happened on and off for a few more times. To the point where, like, last time, like, closer to, I guess, me delivering. And I'm like, no, I really feel like you guys are pushing the medication, but it's draining down my back. It's, it's not working. You're supposed to have pressure. It's not really pain. Are you sure that it's pain? X, Y, and Z a thing. And I'm just like, bruh, like, no, like, I'm like now in tears, because it's just like, I am in pain. Like, it's not, this is pressure. Like, I'm in pain. Like, I feel that the thing draining down my back. It's failing. Because when they first placed it, it was placed too far to the left. And I told him this. My left side went completely numb to my shoulder. If anybody knows that when you get an epidural, it's only supposed to numb in from your umbilicus down. From my shoulder, I literally passed out, had an allergic reaction, almost died, essentially. And they weren't listening then. Like I said, several hours later, I had this thing. The dude literally says to me, "Oh yeah, you're right. It's out." I'm like, "Oh, why didn't we check it before?" But I say that to say, like, yes, there is. So they went through like apologizing to me for hours, etc. Like, another story for another day. But I went into that to say that yes, our pain, our tears, they go unnoticed. So to your point or your original question, finding, and we spoke about therapeutic alliance, finding that person that maybe for a female, going to a black therapist, going to a black female therapist that can relate, to the other medical professionals, screening in your private offices to say, hey, we're screening for depression, even though you might not have it, doing a screen for persons that had a baby, for mental health illnesses that might have came as a result, because having a baby isn't easy.
No, for sure.
Right? So like now this is a new life change. You've gone through all of these different hormones and you're out of whack. You need somebody. So I would encourage anybody who just had a baby, is having a baby, the pressures of life, when people are asking you, hey, when are you having your baby? Like those things happen, and those they do spark, mental health issues, because it's just like, why are you out in my business? Right? So it's just like understanding that it's okay to talk to somebody, and just finding that right fit.
Counseling, therapy, psychiatry is very expensive. A lot of times it's not medically covered fully, and we know that it's expensive. And it's just as important as other parts of your body, nervous system and reproductive system.
Right.
Is there a way for us to advocate for this to be covered, or are there free to minimal cost clinics or options for people to take advantage of on the island?
So if you're speaking specifically to the Bahamas, there is the notion that mental health is expensive. Healthcare is expensive. But to that, I say, there are people that say healthcare is expensive, for example, but they're in the bar every week. So you're going to spend hundreds of thousands of dollars drinking away your sorrows when you can actually be doing better. People say the gym is expensive, but you find your way to the gym because it's healthy,
is,
right?
100%.
It's healthy. So it's what is your expensive? This is too much. Dying is too much too.
Absolutely.
Right? Doing something that can cause your life is too much. So what are you willing to spend your money on? But outside of that, it's important to reach out to the insurance companies, because they do. Some of them don't cover mental health issues, which is kind of sad. But I think a lot of them are becoming more cognizant to the fact that mental health should be covered. It should be one of those things that you get your annual physical, you need a mental health check too. Which I always find weird is that some insurances don't cover like eyes and dental. Aren't I a whole body? Like, why are you saying that my teeth shouldn't be covered and my eye checks shouldn't be covered? Same way. So I think, advocating to those insurance companies, making sure that they're aware that, hey, I'm a whole person. That includes my brain. That includes my eyes. That includes my teeth. Like, can I get a wellness? So that's one thing. And just making sure that everybody's on board. And like I said, in terms of the expense, it can get expensive, but how much do you want to pay? Do you want to pay in life, or do you want to pay in death? And to answer your last question, as it pertains to, there are private entities that cover mental health, and there are government entities, and I work for both. So there are, the government sector has the in-hospital sector, which is St. Helens, and then there's the community counseling and assessment center on Collins Avenue that deals with the general public. People say the $5 to pay for, what's it called? Your check-in fee. That's expensive. So, I mean, expensive is relative, right? So essentially that's a free service, because a lot of times if you don't have the $5 to check in, we're still going to see you. But this is another cringy thing, because this is kind of segueing into something completely different, but it's about general medical health. In our community, people don't like to pay for healthcare, which is crazy to me, because they feel as though you should go to a hospital, have a baby, have a service, and not pay for it. Why? It's expensive. Like, speaking to my own experience, everything that they do in the hospital is a cost. Taking your blood, drawing any test, giving you oxygen, those things are associated with a cost. But in our community, we feel as though those should be free. Only Jesus paid it all. Like, someone had to pay the cost.
Once again, faith without works,
Right.
guys.
So at the end of the day, it's just, what do you deem important for yourself?
Yeah. No, I think, I 100% agree with you. Yeah, man, so this has been a great conversation. I enjoy this, right? But this is the segment of the pod where I want to leave a milestone with you guys, right? And as you know, this is something I want to leave with you to take away, to think about, ponder about, and apply to your lives, right? And the milestone today is simple. Your health is important too. I don't think it's something that we should neglect. Like, it is going to be impossible for us to fulfill our purpose if we're not able to live long enough to do so, right? So your health is important, and that includes your mental health. We're in Mental Health Month, so we're bringing awareness to mental health. So I want to encourage you to understand and believe that your health is important too. If you're not getting yearly checkups, semi-annual checkups, do so, right? I think we need to make ensuring that we are healthy and prepared to live long and effective lives. You need to make that a norm. And just understanding the fact that your health is important, I think is something that we all should know and believe in. All right. So your health is important too, and be healthy and live a long life. All right.
Thank you.
So we've come to the end of the pod. This has been such a great pod. Dr. Knowles.
Thank you for having me.
Thank you so much for being here. I think I'm going to make this a consistent thing. You'll probably be a friend of the pod now.
I love it.
The psychiatrist to the Myles High pod. So you're going to be a consistent face here on this couch.
I'm ready.
And we're going to be continuing this conversation. For those of you out there who have listened to or watched this pod, whatever platform you're listening to or watching on, and you have a comment, you have a question, put them under this particular episode, and I want to address those. And if we get enough questions, we get enough comments, we're definitely going to bring you back. Even if we don't get enough, we're going to bring you back.
I'll try to look and make sure I can answer the questions too in the comments.
No, for sure. But we do want to have you back so that we could address those, actually on the pod. But I think it would be good for you to give your contact information, IG, social media platforms, all of that. Let's let our listeners know where they can find you if they want to.
So I am in government and private practice. I work at Sandilands Rehabilitation Center. I work at the prison at the Bahamas Department of Corrections in the forensic service. I also work at Princess Margaret Hospital during my on-call hours. And currently also at Oak Tree Medical Center. You can find me at the specialty clinic on Collins Avenue. So I'll leave my number on the screen.
So the number is going to be somewhere on the screen here.
Aye. You
guys could contact her, reach out to her if you need some help. But unfortunately, that's for our folks in the Bahamas. For all of our international listeners, if you're ever in the Bahamas and you would like to get in contact with Dr. Knowles.
International coming soon.
Oh, boss lady going in. Congrats, man. Congrats on everything.
Thank you. Thank you again for having me.
Thank you again for being here, man. And as you know, as always, this pod, the goal is to entertain, educate, and elevate you miles high above your fears, your doubts, and any limitations that you feel exist. Always knowing that those limitations only exist in your mind. This has been a great pod. Thank you for tuning in. I'll see you guys next time. Y'all stay blessed.